around with our butt walks. And what butt walks do is it helps load and activate the Quadratus Lumborum, this muscle that kind of sits out here in the flank. And a lot of times in an acute lower back pain episode, we have to treat this muscle because it gets too taut. It's a poor lumbar spine stabilizer due to its distance from the core. It sits all the way out here in the flank region, kind of between our rib cage and our iliac crest. So it's not really close to the spine. It's not an effective lumbar spine stabilizer, but it does contribute. So once we can get through an acute low back pain episode, whether we're doing dry needling, muscle releases, stretching, and some adjusting to the lower back, we want to kind of build that back up. That's kind of one of the tenets of how we treat patients. You know, we put the fire out and then we build it back up. So a great way to kind of build up some resistance and some resiliency in that area is with a butt walk. So the position in the setup, this is kind of a prerequisite before you can do it, is you have to be able to maintain a long sit position. So whether you do this on the floor or on the table, it probably helps to do it on the floor because you'll get a little bit of friction, is being able to kind of sit up in this position with our rib cage over our pelvis. So it looks like I'm sitting up against a wall. You know, I have good spinal alignment. And then from here, we can kind of just cross our arms. We're going to try to walk forward using just our butt. The reason this is effective at kind of using that muscle is because it forces us to kind of lift and then go forward. So it kind of looks like this. And the reason I like it, besides activating kind of the core and the Quadratus Lumborum, is it also gets us kind of doing this with our hips, being able to kind of glide one forward and then bring the other one up. I like that differentiation between our hips and our lower back, and that's an effective exercise. So try a QL butt walk. Sit up really tall, kind of create that long spine, and then you're just going to kind of walk forward. You're going to do 7 to 10 forward, then kind of slide yourself back, and you can do it again. Try not to use your heels too much, but this is called a butt walk.